Hi, I'm Dr. Loken, and I'm going to be talking about getting ready for breast cancer radiation. So, this is for the situation where you and your radiation oncologist have decided to go ahead with radiation treatment to the breast or chest wall or lymph node areas. And the first thing that will happen is that you'll come for a CT simulation visit. There's a couple of other steps behind the scenes, but you'll have an appointment to come to a suite that has a CAT scanner in it. And the staff will spend a lot of time working with you to get the best position, a balance of comfort and stability. Typically, both arms are up. Usually, you lie on your back and occasionally on your front. And there's various types of support and devices to get the best position. And here's an example of a foot support, and you can see there's a knee rest as well. The idea is that you're going to be in the treatment position for a little while, so a stable, comfortable position is really worth working for. One thing that's not obvious is that if you're being treated on the left side, and occasionally for things on the right side, but mainly on the left side, is that the staff will assess your breathing. And the idea is that if you take a deep breath, your chest wall and the breast move further away from your heart. And it's possible for these radiation treatments to be given just when you've taken a deep breath and holding it. And in some cases, that can give a better avoidance of underlying structures like the heart. And so, just to show that in a bit more detail for the left side, uh, on the picture on the left, you can see the heart underneath the chest wall and the breast above that. And on the right-sided picture, the person's taken a deep breath, and the heart stays back, the chest wall moves for up and out, and the breast moves with that. So it separates the area that we want to treat with radiation from the underlying structures. And the goal is that you can hold your breath in a nice, steady way for 20 seconds. So a lot of people can manage that 20 seconds, but occasionally people can't, and especially if they have background lung problems. And we can work around that. But if you can, all the better. And in addition to the business about the breathing, the staff put a variety of temporary markers on the skin, uh, little things that look like little BBs and things that look like little wires. They're all taken off, but they do put several, typically at least three and potentially four, permanent tattoo marks that look like little ink dots. And those are useful because when you go for your treatment, uh, there'll be some lasers in the treatment room. They can use those permanent markers as a reference point to make sure that your position is just how it should be. And depending on your particular situation, the staff might make special positioning devices. For example, if the breast has a tendency to uh, move to the side of the body when you're lying down, as opposed to staying more at the front, the staff can make a special device to position it in a more reproducible way. So when they've done all that and they've whipped you through the CT scanner, then you're all done. And behind the scenes, people will work from there. So the CT sim is one thing. Then there's a team effort going on with treatment planning to get you ready for the treatment start. So thanks very much.